I think one of the biggest disparities between medicine and other fields is that the research and clinical care are really in separate spheres. Now, there are good reasons for that. Conflict of interest was obviously always something that people were focused on. But nowadays, with the ability to make data gathering and data sourcing and data analysis much more transparent and still have it be secure, I think there's really an opportunity for everybody to participate in the research that's necessary to continuously optimize wellness and healthcare. One of the things that is an obvious example is the COVID pandemic. We're now in a situation where probably some 500 million individuals have been infected with a virus that lasts for 3 or 4 weeks. And yet the body of evidence, even including all of the randomized trials for vaccines, is still probably in the order of only 100,000 people. Why is it that there's this massive disparity for a pandemic that we had about 100 years of warning that it was coming? And I think some of it is the fact that we've just failed to engage patients in understanding, A, how big the questions are that we still need to answer, and B, how important they are in answering those questions. And one of the real successes, I think, of the pandemic is the fact that people are beginning to recognize that communicating information and the uncertainty around information is a really important task for biomedicine and particularly for researchers. And I'm hopeful that will move the needle. But I do think we also need much more direct ways of offering to patients and people who have not yet become patients the opportunity to participate in biomedical research so that we can understand how diseases evolve over time instead of just looking at them cross-sectionally. If we were collecting information in large population-based studies or even in just daily life, empowering people to record and collect the information that they might need later in their lives and that they could then seed to researchers to understand the trajectories of disease, I think that will be really powerful. And we're very focused in One Brave Ideas, I know you are at the American Heart Association, in trying to reach out to the whole population and try and have people understand how they can, oftentimes in small but very concrete ways, contribute generally to the body of data that we're collecting as a community that will help inform biomedical research.